kind of exactly this focus where it's about it's about physician advocacy for kind of all social justice reasons. Mine, as you'll hear a lot about, is my greatest concern is climate justice and stabilizing our climate because of the health crisis it is. But I think it's really an important, like critically important discussion to look directly at the role for physicians in advocating for social justice across the board. There's lots to work on, obviously. So this is new content for me, and I'm really excited. And I definitely am going to kind of ask some questions. And I don't love virtual conversations, but we're going to make the best of it. And I'm going to ask some questions. So I would love hearing your input. And once I start presenting, I can't easily see the chat. So Erin, maybe you could kind of chime in if there's something to talk about in the moment, which I'm really open to. And then I will ask for people to just kind of share some answers as we go. So let's see. I'm going to try sharing my slides. Okay, present. How are we doing? Is it working?
Yes, we see your slides.
Okay, wonderful. So physician advocacy, that's what we're gonna focus on. So the ground rules, I'm going to invite questions, like I said, and it will be more fun and interesting hearing from many voices. And I'm going to kind of play with the Socratic method. So lots of questions and opportunities for you to share your perspective. So yeah, maybe you could raise your hand on Teams if you were here in the Bay Area for the infamous Paradise Fire almost exactly 2 years ago. Yeah, so I definitely was. And this was really my kind of awakening. When the fire was happening, I was at home on maternity leave with my daughter, who was about 5 months old. And, you know, we were stuck inside with an air purifier, and I had this new baby. And for anybody who's parent or not, you know, just the way that having this new human whose safety was my greatest priority, I just was kind of awakened to the fact that these fires, these climate fires, like we are experiencing to unbelievable degrees this year, these are the norm that we're headed towards if we don't address the climate crisis. And I, during one of my daughter's naps, I fell into watching the Inconvenient Truth sequel on my phone while she was sleeping. And that was really the moment where I was like, what have I been doing? Like, the world is hurtling towards disaster and really an uninhabitable climate, uninhabitable planet, the only one we got. And I've just been focused on my little tiny life, you know, like training and getting, you know, just kind of very personally focused. And there was like some sadness and grief at just having been sort of asleep to the bigger picture. And this fire and being a mother woke me up to it. So there she is. That's my little daughter, Kala, who's now 2. But really, it was kind of, you know, having skin in the game in the future in a whole new way. And then, of course, you know, I kind of being a physician is really a incredibly valuable role that we have to play in addressing the climate crisis. So I started kind of diving in and trying to figure out the question of, like, the safety of the planet is very much at risk. I'm a physician. What can I do? And so I started, you know, kind of looking at heroes and leaders in our field. And can anybody jump in? This is the part where it gets interactive. Why is Dr. Jon Snow famous?
I think he was doctor in London that kind of mapped out like the cholera epidemic around the water fountain.
That is amazing. Did you do an MPH? High fives. Good job. Exactly. So 1854, without even the benefit of germ theory, he just used kind of the basics of science and tracing, tracing patients just like we are today, and realized that there was a well in London that was infected. So he mapped out kind of where people were getting sick, and then, holding for all the variables, he realized that what they had in common was drinking from one single well. So then he kind of put together his public health evidence, brought it to the city council in London, and said, the only way we can treat this cholera epidemic is if we close this well. And then they did, so it was, they removed the pump from this infected well. So to me, this is really like kind of the example of physicians translating clinical medicine to the root cause, which a lot of times people say it's like upstream. It's not in our exam rooms that the causes are happening. It's upstream in the air people are breathing and the water that these patients were breathing. And he used evidence to translate to policy to prevent the harms. So the father of public health is really what John Snow is kind of known for being. And so with this kind of ethic, of our responsibility goes beyond the four walls of our hospitals and clinics. It's to prevent disease. Also kind of looking upward, the American Medical Association's Declaration of Professional Responsibility, I think really, thankfully, grounds the role for physicians in advocacy. So this is not, we are well founded with kind of the constitution of our professional responsibility to engage in advocacy. And it's kind of long, so I'm going to pull out the key pieces, but this was kind of ratified at the House of Delegates almost 20 years ago. And it says, we, the members of the World Community Physicians, solemnly commit ourselves to respecting human life. And I'm just going to pull out kind of what I think is relevant for today, so refraining from supporting or committing crimes against humanity and condemning all such acts. And I'll give an example of that, how I see us actually doing that right now. Number 7, educating the public and polity about present and future threats to the health of humanity, which obviously climate being my key advocacy issue, that's communicating that climate change is a existential health crisis. Number 8 really just says it all for today, which I'm just going to kind of expand on, that our responsibility, what they call is medicine's social contract with humanity, involves advocating for social, economic, educational, and political changes that ameliorate suffering and contribute to human well-being. And this obviously pulls in so much responsibility beyond just clinical care. And then lastly, which I think is a beautiful example today, teaching and mentoring those of us, those who follow us. And I can't tell you how much a joy it is to talk with residents and medical students also, because I think you are the youth, you are the future of medicine. And there's definitely, in my experience, there is such an appreciation for the challenges we need to be a part of solving that youth like you are aware of, that really has to move our profession, which is incredibly conservative. And it takes a lot of advocacy within our organizations to kind of show that we have a bigger responsibility even in terms of social advocacy and being a part of kind of the movements for justice across the board. So sorry to ask more of you. I know you're already doing a lot, but I really think that you have such an incredibly important role in making medicine engage in broader issues. So diving a little bit deeper into number 8 of our professional responsibility, the kind of advocacy part. So again, inviting discussions, and this could be a very long list, but what are some of the main crises today that you see requiring political changes in order to ameliorate suffering?
Climate is one.
Climate, yeah.
Economic was mentioned in the back.
Mm-hmm.
Gun violence.
Yep. Yeah.
Addiction.
Yeah. Very much a social issue. A lot of overlap. What's that?
Education.
Mm-hmm. Like what in particular?
Better access.
Mm-hmm. Mm-hmm.
Great.
What was that?
Racism.
Yes. Yes. High on everybody's mind, as it should be. Mm-hmm. What other?
Global pandemic.
Mm-hmm. Yeah. COVID. Yep.
Gender inequality. How
Yep.
about voter suppression and rights?
Yep. Yep. You guys are giving me goosebumps. Yep. Yep. Yeah. Maybe one more.
Food insecurity.
Yeah.
Lack of healthcare.
Absolutely. Yeah. Yeah. So gun violence, addiction, kind of income inequality, access to education, racism, the COVID crisis, kind of the crisis of democracy, I guess, is how I would sum it up in terms of the election and voter engagement or suppression, sexism, healthcare, and food insecurity. You guys nailed it. So does anybody know who Dr. Dawn Berwick is?
A lot of head shaking.
Okay. Head shaking, no. So he was the administrator of the Center for Medicare and Medicaid Services under Obama's administration. And he is a pediatrician, and he co-founded the Institute for Healthcare Improvement some 20 odd years ago. And he recently wrote an article in JAMA called The Moral Determinants of Health, which I could not more highly recommend because to me, he's sort of the Jon Snow, or one of them at least, of today's of today. And in this article, The Moral Determinants of Health, that in JAMA like last month, he made the same list that you guys just did. So he lists the crises that physicians should advocate on in order to fulfill our social contract with humanity. And this is the list in his article. So he talks about the US ratifying kind of the basic human rights treaties, which we haven't, which gets at like gender issues and immigration issues also. He talks about realizing in statute that healthcare is a human right, which somebody also mentioned. Restoring U.S. leadership to reverse climate change and the Paris agreements and the work to uphold those agreements. Achieving radical reform of the U.S. criminal justice system, which has a lot of racial and socioeconomic kind of injustices, as you all know. Achieving compassionate immigration reform, ending hunger and homelessness, like you guys said. And then I think that was you, Erin, at the last, restoring order, dignity, and equity to our democratic institutions, and making sure that everybody's vote counts equally. And he even calls out specifically the Electoral College and how that is a crisis that physicians need to engage on. So he's like one of my medicine idols, heroes, because he's bridging the gap between the upstream issues and then what we see, because all of this list has implications for what we see in our emergency rooms, what we see in our hospitals and in our clinics. And so his call to action, which really it is in the moral determinants of health, is saying physicians, and he literally said this I did an interview with him. So I'm not going to play it, but I am going to invite you to watch it, and I'll share it with Aaron. I asked him about his article and other things, and like the role for physicians in addressing the climate and other crises. And he said, most of us didn't go to medical school thinking we were going to like engage in climate advocacy, but the job got bigger, and that there's a ethical obligation to expand our tool set to engage in advocacy because it's part of kind of doing no harm, is using our voice for good. So you guys already, it's, there's no surprise at this list, but I think coming from somebody of his stature, it just really kind of validates it, that it's within the wheelhouse of medicine to engage in these issues. So I'll send out the YouTube. It's like a half-hour interview. And then I think also this quote, which is from the strategic director or partnerships director at the Sierra Club. His name is Hop Hopkins. And I think his quote kind of pulls together a lot of these different pieces. So how all the social justice fights are kind of moving in the same direction. And he says, you can't have climate change without sacrifice zones. You can't have sacrifice zones without disposable people. And you can't have disposable people without racism to kind of, justify it. And I think that kind of intersectionality is something that is challenging, but is also kind of the kind of complexity that we can help to clarify and kind of show the way that these are all related. And this is an example of a kind of campaign that happened here in California this past year to help prevent situations like you see in this picture. So in this picture, there's a fracking well extracting gas in Southern California beside an elementary school playground. And there is an ample evidence about, as you could just intuit, about the health harms of being anywhere near where oil and gas is being extracted because of the chemicals they use, the particulate matter that comes out of it, the toxics in the air related to the extraction process. And, obviously, as it says, this is not okay. And the kids, any human, any animal, anybody should not be so close to this toxic process that is also fueling the climate crisis. And I think, we can all imagine that the kids that play on that playground are not wealthy white kids from Piedmont, or from, you guys are in the city, are from, I don't know, Pacific Heights or some fancy neighborhood. Like, these are the kids in the kind of Inland Empire, in Bakersfield. These are kids in areas like Fresno. These are kids like, in Richmond. This is the example of sacrifice zones and how they overlay with racism and structural inequities that it kind of make it, that set up disposable people to live beside toxic industries like this. So another question, what is more powerful in determining someone's state of health or disease? Who wants to take a guess? Social determinants of health, or our direct medical care that you work really hard to learn how to provide?
We have lots of votes for social determinants of health.
Yeah, something like 80% or so, the majority for sure, of what determines somebody's state of health or disease is related to outside of direct medical care. The air we're breathing, the degree of education you have, if you have housing, if you have food, the air, the water you drink, if you smoke or not. So I think this is so important. And I am old. I went to medical school, 10-ish years ago or more. And we didn't talk about social determinants of health. I don't know. Did any of you get kind of training on social determinants of health in your medical school?
Absolutely.
You did.
Yeah.
So-
Mm.
and then I think the next step is, what did they, like, where did that go? Like, what were you supposed to do with that information?
Pipeline programs, outreach efforts, public health efforts.
Mm-hmm. Yeah, so that's good. That's good because I've heard of a lot of kind of curricula where it's addressed, it's acknowledged, but then, you're training to be a physician and kind of how to engage with this fact that social determinants of health are more important than what we do in what Dr. Berwick calls hospitals and clinical care, he calls it repair shops. So I didn't get that training, but I'm glad that you are. But I think the only way to connect these is through advocacy, as I see it. And this is me with a poster that I used for a project, kind of really articulating why I'm working on climate equity, climate justice, is because I see it as the most powerful social determinant of health. And there are so many that are so important, but I think if we don't figure this one out, we're not going to have time to figure all the others out. So that's kind of just to explain kind of my reason for focusing on climate. And this quote from a medical student right there in UCSF, Derek Paul, he said, "When clinical medicine can't do any more to help your patient, but society can, then social advocacy becomes the standard of care." And, again, that kind of sums up the whole point I'm trying to share today, is that this is not fringe. It's not, it's not controversial. I think it's controversial when it's partisan. And I think it can be hard for some people to distinguish partisan lobbying from political advocacy. And I think that's really been a detrimental conflation of things, because I think it just kind of keeps the medical community quiet, because we're sort of afraid to distinguish those. But I think we are doing a huge disservice to people, to the world, to not be brave enough to distinguish those. Advocacy for the greater good, for safety, versus kind of partisan lobbying. So who wants to guess? What are the top 1 and 2 most trusted voices in America in terms of professions?
Nurses.
Nurses, totally. There they are. There she is. Yeah. And number 2?
Pediatrician.
Okay, so it's physicians kind of generally, but probably pediatricians are up there. Yeah. So that's a really incredible tool. And I say this very actually seriously, that I see our trusted voice that we work hard for as our social justice. And I, more specifically for my particular focus is our climate advocacy superpower, because we live in a time where, of fake news, of gaslighting, of, kind of not a lot of shared reality, but our profession gives us this incredibly important voice to bring to the general social movements that are working for justice. And I think we are underutilizing the strength of that voice because of kind of fear of being political and not understanding that not all political activities are partisan. So to try to visualize this, seeing our trusted medical community voice as our superpower in terms of social justice movements, and that's what we have to leverage. And we're kind of leveraging on a shared universal value of protecting human health and safety, which is related to that long list that we made earlier of healthcare and education and racism. And we can bring, as a profession, we can bring our trusted voice to the wider social narrative in order to support justice or support policies that that support justice, whether it's the criminal justice system or it's universal health care or it's climate advocacy, climate solutions. This is kind of a visualization of how what I see our role being in the movements for progressive changes. And this makes me think of this quote by President Obama, and he said, "The arc of justice may bend toward no, the arc of history may bend towards justice, but it doesn't bend alone." And I think, our voice can help to bend it towards justice because of how much trust the kind of our communities have in us. So leveraging, this is a picture of an example of leveraging that trust. And almost a year ago to the day, this is a group of us who on the global climate strike last September, this is a coalition of physicians and medical students and nurses who went to visit Senator Feinstein's office. And our whole point was pretty much summed up in our signs, trying to help her staff understand and kind of leverage the fact that climate change is a health emergency, because when people hear about the climate crisis, the framing for the messaging around it that's most likely to elicit support for solutions to solve climate change is the health message or the health frame. So the more that somebody understands that burning fossil fuels, causing climate change, warming our average days, making air pollution worse, affects their kids' health, that is the message framing that's most likely to kind of get somebody to vote for a Green New Deal or for carbon pricing or for subsidies for renewable energy. So that's what we were trying to get the message to her staff. I don't know if you can see my mouse, but this is her staffers right there. And so we really wore our white coats in order to maximally use the power of our professional trusted voice in advocacy. So this was last year. This is one of our medical students. And we kind of had we broke down like an agenda, and we all had different roles and parts of the meeting that we led, and it was really cool. And then this State Senator Wiener's office, we went there in December on the Youth Climate Strike Day. Again, just the messaging of helping our elected officials to understand that using the health frame for climate is a way to overcome the incredible partisan kind of gridlock, and trying to help them to kind of use that frame because it does help to move forward support for climate solutions. And then this one, he might end up in DC, but this is, we were at Senator Harris's office, again on Climate Strike Day, just kind of saying the same thing, is that, we can't, as doctors, like this in the middle, this is a medical student from UCSF, Sarah Shear. And our point was, as doctors, we can't protect people's health if you don't implement solutions and policies to address climate change and to transition us off of fossil fuels. We can't protect you in our offices, and that kind of gets to the social determinants of health pieces. We need policies from our leaders that make the environment safe and healthy in terms of the air we're breathing and the water we're drinking. So we were saying, can you join our team a little more strongly and make these policies keep people safe upstream? And then also a year ago at Speaker Pelosi's office, kind of with the same message, trying to be really clear in our messaging. And then this is the last picture I'll show is out front. So that was at Speaker Pelosi's office inside the federal building in the city. And this is the urgent climate care clinic that we set up in front of the federal building. And we actually handed out medical excuse notes for students who were striking to say, we as doctors support students striking and don't expect this to be the last day they miss for climate reasons because of, the air pollution that's getting worse, the extreme heat that's getting worse, the climate fires, things like that. So it was pretty awesome. So another way to advocate as physicians is in writing things like op-eds. So this also about a year ago, my climate best friend, Amanda Milstein, who is a pediatrician here in the East Bay, we wrote an op-ed in the San Francisco Chronicle trying to get this message across that climate change is already affecting your health, in order to try to boost support by helping people to connect it to their own kids' safety, to their own health, making it more personal than polar bears. And then in terms of kind of social advocacy for our profession, I'm sure everybody here is very, very well aware of the White Coats for Black Lives movement. And this is a picture from Times Square. I forget which university this is, but kind of the power of our profession bringing our voice and the gravity of our voice and the trust in our voice to social justice movements, whether it's racism or climate or any of the other number. And this is here, us here in Oakland a few months ago. So I wanted to share, actually, let me share one more. So this was one other example of kind of advocacy. We had a Zoom meeting with a senator's office about a bill that actually did not pass that was to try to create setbacks between where people live, work, go to school, and where oil and gas extraction is happening in California. Most other states that produce oil and gas have setbacks, so that there's kind of a health buffer. And so we were meeting, here's me, and here's a staffer with the state Senator Huesos's office. And we were kind of saying the same message, and it didn't pass actually because of the Western States Petroleum Association and a fear from the labor industry about losing jobs, which is kind of the business as usual. That's usually the opposition, is the oil and gas companies and labor who's afraid of losing jobs. And that's why the issue of a just transition to include workers in the oil and gas sector has to be such a central part of our transition to a clean energy economy. So then a couple of people also mentioned kind of the safety and health of our democracy, and voter suppression as one of the other crises that we're facing right now. I think we have about 43 days to the election. So I just wanted to share a couple little pieces of resources. And there's a great website. There's a few different ones, but the one I've been using and like a lot is called votehealth2020.com. And it's focused on healthcare in particular. And it's kind of helping to make sure that everybody who works in healthcare, which is many millions of people, I forget exactly how many right now, that we have 100% voter turnout, and that we help support our patients to vote and have their voices represented in the election in a safe way, obviously also because of COVID. So there's many layers to the importance of this, but I couldn't encourage you more to kind of check out this website. And it's awesome because I've actually done this on some video visits, and I have put a link to this website that helps patients to make sure that they're registered to vote and that they have their correct address, because all of us in California will be voting by mail. But if you have the wrong address, you're not going to get a ballot. So this is a way that I've been trying to help kind of empower my patients, which I've actually found to be really a cool way to build solidarity. Like times are hard, we're all really limited, but I care about your voice being represented, and I've had a lot of positive feedback from patients. And I think this it seems intuitive to me, but the important thing, of course, is just saying, I want you to vote. I don't care. I do care how you vote, but I'm not going to tell you that. I'm just going to say, I want your voice to be heard because you matter. And I think the solidarity that we communicate with that is really powerful. And Kaiser, today is actually National Voter Registration Day. So you may see, and we're trying to help support this, you may see some of these QR codes around our medical centers to indeed help support our patients to engage. And I think, the challenge with voter suppression is many layered, but there's, people who are kind of typically disadvantaged, whether economically or education wise. There's so many more barriers to them being represented in elections. And so most people access healthcare. So that's one of the ways that we can help to kind of rectify the unequal representation is by empowering our patients to vote. So another question. This is a tough one, so you would get like a bonus Teams point if you can answer it. Does anybody know who said that all disease has two causes? One is pathological and the other is political. Going way back to like Jon Snow's colleague.
Do you have a guess?
So, who is that?
No, we don't have it. Lots of head shaking.
So Virchow's triad, he was a physician, but he also engaged in politics. So Rudolf Virchow of the triad, he said this back in like the mid 1800s, which I think, it rings true now just like it did then. And I think that's it helps to explain the role for physicians and nurses and the medical professions overall in advocating, is because we can't do it all in our repair shops. Like, it has to be prevention, and it has to be addressing the social issues, the social determinants of health, which is, we do that through advocacy. And I love this quote from the Healthcare Without Harm website that says, as the only sector with healing as its mission, healthcare has an opportunity to use its ethical, economic, and political influence to be a leader in climate solutions and other social justice solutions, you could say. So kind of getting towards wrapping it up, does anybody want to jump in and just kind of say, why do you think Dr. Berwick wrote the article he did right now? And what's the rationale that you see based on what I've shared in the discussion I'm excited to hear about that you had before I joined? Like, why is this something for physicians to engage in?
It's already on you. Try again. Go ahead. Okay. Why are the moral why is our jobs part of the moral determinant of health?
I think there's an election soon. I think it's important for us. I think that the timing was intentional.
Mm-hmm. Definitely.
We have a comment, because we're at a tipping point in our society, from Jin Will.
Mm-hmm. Yeah, it definitely feels that way to me. It's kind of a call to action to engage in leadership on the social determinants of health with the tool that we have, which is really the trust that people have in us. Mm-hmm. This might be a good point, because after this, I'm just going to share some kind of resources. So this might be a good point to bring in kind of the conversation that you guys had earlier about the video of Dr. Holder. I think there's a lot of overlap, obviously, in her message and Dr. Berwick's. So does anybody want to share about what that video brought up for you, and kind of how you see that overlaying with the role of physicians in advocacy?
The comment that was made after the video was about the contribution of the U.S. Healthcare system in negatively affecting climate change. That we're the number 2 industry in carbon.
Yeah, and climate pollution.
Yeah, and what is our profession doing about it?
Mm-hmm.
And I think there was a commentary about Kaiser Permanente specifically, but we didn't have all the details on how maybe Kaiser is leading the way, or at least making concerted efforts to reduce our emissions.
Mm-hmm. Yeah, I can speak to that. So we are going to have a different talk that's really focused on climate change in particular. I think, is that next week, Erin?
Yeah.
At lunchtime. So that's why I didn't dive into that, but I will, and I would love to. I just wanted to keep this more about kind of social advocacy in general. It is true that Kaiser Permanente this month, actually, we announced that we are now carbon neutral. And we did that through reducing our own emissions through things like, the anesthetic gases that we're using, using gases, using less of things like desflurane, which is a super powerful greenhouse gas, and using other anesthetics instead. The electricity that we buy for our hospitals, we are sourcing from renewable sources, wind and solar primarily. This is all about our internal operations, which is an important part of kind of the process. But it's not about social advocacy. And I, as a physician, I work for TPMG, and I think we have done a lot in terms of our internal work for addressing the climate crisis, which is important, but we have not led in the way that I really think we need to in terms of the social advocacy for policies, because it's great that we're getting our own house in order, and that's a very important thing to do in order to have integrity when we go to lawmakers and say, we need to stop subsidizing fossil fuels tomorrow. We need to kind of have done the work internally, but because our profession is the home to the most trusted voices in America, if we stop at our own hospitals and our own clinics and the climate footprint of those, and we don't advocate for broader social policies to make renewable energies, to subsidize those and to make kind of the economics turn towards a transition to clean energy, we are doing a disservice to the world. So I think it's safer for us to work on, sourcing electricity from a wind farm. That's safer than going to lawmakers and say, you need to stop giving fossil fuel companies subsidies because this is harming our patients' health. That's harder because it's political. It doesn't need to be partisan though, but I think that is the missing piece in terms of our work, is really the climate advocacy in a very clear way. I think we're doing it in a very conservative way, but we didn't see the sunrise, 8-10 days ago, and that is from climate fires. And I think we need to act like this in emergency because it is, and we're the time for being really conservative and safe was 30 years ago, but we're in an emergency. And I think the advocacy piece, like our lobbyists in Sacramento, our lobbyists in DC, our government relations department, that's our opportunity for social advocacy. And then I'll finish by saying, so US healthcare on whole produces about 10% of America's greenhouse gases. And that's, we have a very energy intensive profession. Our hospitals are on all the time. We use a lot of energy. So that's what KP is leading on, is reducing our own footprint. There's work to be done for sure, but we are working on that really well. But I think the greater opportunity is the voice for social justice. You know, it's Dr. Virchow's comment was not about like, you know, keeping your own hospital safe. It was about that diseases are being caused by policies that are unjust, and that physicians have a role to advocate for making all the ranges of social issues and the social determinants of health fair, because that's more important for the health of our communities.
Is there a way that you recommend for, you know, for a busy resident who's trying to juggle their clinical learning and responsibilities, but is there, you know, some role for us to play in helping to promote certain policies or getting involved in a smaller way?
Is there ever? Yes, totally. I'll go to this slide first. So I have 2 slides on that question. So ways to link arms in advocacy, because to me, in my experience, you know, these social justice issues are collective issues. They're not about like whether I'm recycling the plastic from my lunch. You know, they're about kind of the systems that we're a part of, and that can be so overwhelming. And I think the only way to engage is through partnership in joining groups that care about what you care about, because it's only through kind of teamwork that we're going to address these collective solutions. So being residents, has anybody on the call heard of the Northern California White Coats for Black Lives group?
Yes, we have
Good.
a representative from our program.
Perfect. Okay, so you already know about it. But if you didn't know or whatever, the email is linked to your Kaiser NorCal WC4BL at Gmail. So I have talked some with Vivi, one of the residents who kind of co-led it. So that would be one thing. And I guess I'd also like to ask, would anybody want to share like what social justice issues are you most inspired to work on? Because I know of a lot of different groups. So if you kind of like, if you need guidance on groups to join in terms of different issues, I could tailor it a little bit. You guys want to work on climate with me? Is that what you're saying? So if you do, I mean, feel free to, you know, email me if you're like, I want to work on, you know, immigration or something particular.
We have a resident who's interested in police brutality as a public health issue.
Yeah. So there is a Department of Equity that's part of the AMA. The vice president, her name is Aletha Maybank, and you can search for her, and she kind of has been hosting a lot of really fantastic panels and conversations about equity, and as they've had conversations with like you know, the coroner of DC's kind of a lot of different conversations happening about police brutality and the overlay with public health. So if whoever wanted to talk about that, that's one person I would think about, is reaching out to Aletha Maybank at the AMA. And if you wanted to email me, I could connect you if that would be helpful. Are there any others in particular? Okay. So ways, if climate's your thing and you know, you're busy residents, like how to engage, I have started actually a nonprofit called Climate Health Now. And you could send an email to our website to just kind of say, hey, I'm interested, like, can you loop me in? Because I think that's really the only way to start is by finding friends. So if you want to work on climate stuff with me, more generally, this is beyond just Kaiser, kind of California wide, then you could join Climate Health Now. We also, is anybody, Erin, you said maybe not everybody is, but is anybody a CMA member, the California Medical Association member?
We have one hand. Sorry.
Cool. Who is that?
One of our interns, Esme.
So there's a lot, if you're interested, we have a group, there's like 50 of us within CMA who are trying to kind of create and organize and move forward the leadership of CMA, which is about 55,000 physicians in California. So if, Esme, if you want to reach out, I'm happy to loop you into that. I also do a news, what's that?
Sorry, another topic I think that kind of generally our program is working on is allyship and anti-racism.
Mm-hmm. Yeah. I mean, I think, yeah, that the closest thing I could come to, I mean, we do have the Office of Diversity, Equity, and Inclusion, which they've been doing a lot of really fantastic talks, grand rounds. But the kind of team that I would say join this would be the White Coats for Black Lives group here within KP. And then I do a newsletter for kind of the social determinant of health issues. So if anybody's interested, let me see if I can put this in. I'll put this in the chat if you want to kind of get updates for kind of things specific to KP, but too political to use kp.org emails, which there are some things like that. So let me put, I'm going to see if I can put it in the chat. And then the last piece I wanted to share is, you know, when I was talking about the professional obligation responsibilities that the AMA mapped out, and they said, you know, we should abstain from causing crimes against humanity. I think continuing to burn fossil fuels is really a crime against humanity today and especially tomorrow because of the challenges that a warmer world is going to leave the future with. And the way to kind of ground this in a really specific way is that KP has a pension, and our pension is invested, like other things, in fossil fuels. So I have started a pledge of support that that is for residents and physicians to say, I support us divesting from fossil fuels because it is it really is a crime against humanity tomorrow, you know, today and tomorrow, because of the health harms and the incredible like social strife that a warming world is going to cause from all the disasters. So if you agree with me that you don't think our pension should be invested in fossil fuels, I'm going to do my best. I'm kind of struggling with the chat thing right now. You could co-sign that. And then I wanted to share one other way. Oh, and then the last thing is that this Friday, I know there's very little heads up on it, but this Friday, Stanford is holding a Northern California Pandemic Resilience and Sustainability Symposium. And so there's going to be a lot of really great talks about kind of the role for healthcare in leading the transition to clean energy and also kind of the resilience aspects of that. So that would be kind of a opportunity to learn more and kind of, you know, see what else is going on if you're interested. So I think that's about it. I have just a few minutes before the top of the hour. If anybody has any questions or comments, I'm eager to hear.
I have a quick question about like the climate issues you raised and really regarding policies. It sounds like one of the main arguments is against the shift towards like better energy sources is this like job issue. And I imagine on some level that's, you know, something that is a socially acceptable thing for lobbyists to kind of go and point at. But I'm wondering if there are certain particular broad sweeping kind of goals, or like in your perspective, do you think that when there are proposals and advocacy events, whether that actually has kind of taken a priority as proposing alternative jobs and ensuring that there are, you know, like adequate jobs and support for people who, so that we don't leave this group of people behind.
Mm-hmm. Absolutely. I mean, I think it is the center of the climate challenge is what's called a just transition. And what that means is we're not going to leave anybody behind. So that, things like a climate core, like we had in the New Deal, the original New Deal, we had the conservation core, which was like a jobs training program that put people to work, that gave people really good jobs. And I think absolutely we're going to need the same thing for the people who work right now at the terminal in Richmond that ships out coal. Like it has to be at the center of every climate plan, is how to bring everybody forward and how to transition the workers, the corporate executives less so, but the workers, to give them family supporting jobs in the clean energy economy, because it is the center of the transition, is including everybody, and we're not going to move anywhere without it. So the just transition, that's why the Green New Deal is a resolution. It's not policy, but it very centrally places that need to include everybody and to transition workers, just like is already happening. There's like coal plants in West Virginia, and part of kind of shutting those down has been giving job training into other sectors. So a lot of that's already set up kind of through unemployment offices. There's ways that we like vocational retraining. It's just a matter of doing that on a massive scale for climate and the energy sector.
Well, thanks.
Yeah.
Awesome. We have just one other chat question, which was more specifically what Codes for Black Lives is doing, like what's on their agenda. But so we can ask you next week as well.
Yeah, I would encourage you to get on their listserv, because I just got an email about they're calling it Committee 2, which is about like a living wage for our cafeteria workers. So I do have to run, but I know that that's one of their main issues. The other one was about having the amount of our patients who have Medicaid kind of match what the community percentages of patients who have Medicaid, because right now it's just a teeny fraction. So yeah, if you want, I could share with you, Erin, the email, and I would definitely encourage people to sign up because they're doing really good work.
Great. Okay,
Yeah.
thank you so much.
Yeah.
Time.
My pleasure. Thanks for having me.
See you next week. Bye.
Okay. Bye.
Okay, everybody else, I think you'll be off. I guess I just need to unpin her. Okay. Okay, so we have a short break, so people who weren't working that whole time can do some more work. And go to the bathroom, get lunch, which is coming up shortly. And then at 12:30, we're doing that discussion group. A couple weeks ago, we listened to the Vital Talks web course, which was about how to discuss goals of care with your patients. And hopefully some people have practiced those skills, because they're going to ask you for those examples. So we would love it will need to be participatory, and that's going to be the 12:30 hour, and then we're done for today. So today's Teaching Tuesday was a little bit more miscellaneous. Next week will be, again, more ID themed, and then next month is HEMOC. Okay. Any questions, comments? Put them here. Do people like that? Let's see. Let's make sure she's on. Do people like or appreciate some like advocacy and health policy lectures, or is the preference for like just straight clinical, or thoughts? Head nodding. Okay. Yeah.
I think it's important to have that.
Yeah.
Balance.
Okay, and then if you have any special requests for future talks, because we'll probably do like one non-themed Teaching Tuesday a month, basically. We're happy to take recommendations, suggestions, or whatever. Okay, great.